Hi guys, in this video we are looking at the trunk muscles. So look at this. This side of the model is superficial when we compare to this one. You see, this one is one layer deeper. So when we look here, this is the pectoralis major. When we remove the pectoralis major, which is all this, we can see the pectoralis minor, which in real life is underneath the pectoralis major. Remember, this side is a little deeper. Now, when we look at this, do you remember what these are? These are ribs, right? And this part right here is the cartilage that connects the ribs to the sternum, specifically hyaline cartilage. Now, look at this. We have this muscle that's coming right here and grabbing the ribs in the anterior aspect. And our ribs look like a serrated knife. That's the reason why this muscle right here was named Seratus anterior. Now, if you have the Seratus anterior, you can bet you have the Seratus posterior in the posterior aspect. And here you have the Seratus posterior grabbing the ribs on the posterior aspect of the body. Now let's go back to the ribs. Here we go. Between the ribs, we have muscles. Do you remember how we call ribs in anatomy? We call them costals. Now, how you believe that we would name muscles found between ribs? They are named intercostal muscles. Now, we have the ones that's closer to the external aspect of the body. So this one right here in this model is what making a reference to the external intercostal. And when you come to lab and you see the model in real life, you see that this one is a little deeper. And this one is the internal intercostals. Now, one thing that gives away that this is the external intercostals is because the external intercostal muscle fibers, they always run lateral to medial like this, because this is the midline of the body. And this is lateral to medial, lateral to medial, lateral to medial. And you remember that the external intercostals fibers always run lateral to medial because every time you say external, you make an X in front of you and you say lateral to medial, lateral to medial, lateral to medial. So the external has the fibers running lateral to medial. And you look in the model, you see here, lateral to medial, lateral to medial. And when you look at these ones, you see that is medial to lateral, medial to lateral. So if this one is medial to lateral, that is the internal intercostal. Now, the same rule that the external runs lateral to medial and the internal medial to lateral applies to this other muscle right here. Let's see. This side is more superficial, right? And this one is deeper. Now, this muscle right here, can you see that the fibers are running in an oblique way? This muscle then is named oblique. Now we have the external oblique and the internal oblique. Look at this. These fibers are running lateral to medial, lateral to medial, lateral to medial. Do you believe this muscle would be the external or the internal oblique? This is the external oblique. And when you look and this side that's deeper, can you see that the fibers are running medial to lateral, medial to lateral? This one is the internal oblique. Now, I just disassembled Philip and I would like to show you this. Can you see that here we have the ribs? Yes, so those are costals, right? Now here we have the muscle that's between the ribs. What's the name of the muscle? Intercostal. Would you believe that this is the internal or external intercostal? Guys, you are inside the body. This has to be the internal intercostals, right? Because when you're looking right here, you can see the external and the internal. But if you're just looking the inside of the body, this has to be the internal intercostals.